Elderly family member ends up in the hospital can be really stressful. We're not only talking about going in, but also leaving. So how do you make that transition easier? Dr. Arbaje from Johns Hopkins Bayview is here to help us. Thanks for coming in this morning.
Thanks for having me.
We were talking about this. You're so happy to leave the hospital. You're literally running out the door. You don't think about what you need, right?
Right, especially our older patients. They're so excited to be leaving because it means that they're getting better, that they often don't think about how the real challenges sometimes occur once they get out of the hospital and go to the next place, whether it's the rehab place, the nursing home, or whether they go home. That's when the real challenges can begin.
No matter what the situation is, I would listen to this because I would never think of this personally if I were leaving the hospital. But you gave some great tips, so let's go through some of them. You said keep your own personal file.
Right, so a lot of times things can get dropped. The ball can get dropped as people leave, and sometimes information doesn't get passed along. So I often recommend to our patients to keep track of what their health conditions are. You were just in the hospital for a few days. Your doctors have that list there if you don't have your own. Ask for a copy of that list, and ask for a copy of the list of your medications so that you know exactly what you're dealing with. And then I would update that list every time you go to a new place so that each new person that you see has an updated list of what's going on with you.
Okay, that's a good one. And you said a list of all your health conditions too.
Right, so we often think of the medications, but it's also important to know what the health conditions are, even ones that aren't very active. Most of the time people leave the hospital and they think they know why they were there. Oh, I was there because I was short of breath, but they don't know that they actually had a special kind of pneumonia or something very particular. So it's good to know exactly what you're dealing with when you leave the hospital.
You also say take charge of those meds.
Right, especially the over-the-counter ones in addition to the prescription medications or any herbals and supplements as well. And not only should you know what medicines you're on when you leave the hospital, but what they're for and what side effects you need to look out for.
Now, what does this one mean? You say also make sure that you understand all the services that are available.
Right, so often when people leave the hospital, they're thinking of their medications and their diseases, but they don't often realize that an older person in particular needs a lot of services when they leave. They might need oxygen, they might need a home nurse to come see them twice a week, they might need some wound care of an open wound that they have. So those are different examples of services, or physical and occupational therapy. And often that's the most important kind of service that helps keep them from coming back into the hospital. So it's important to understand what services you're going to receive when you leave and who's responsible for arranging those.
And you also say when you get to a new setting, make sure you have everything in place.
Right, exactly. So it's the hospitals and the medical system's responsibility to work with you to make sure that all your care is being coordinated. So it's very, very important to have that information. When you leave the hospital, ask, who am I supposed to call if something goes wrong? So that's very important to have that contact information.
And that's probably where the next piece of advice comes in. That's bring a friend or bring a relative.
I really recommend this because, as you were saying earlier, people are so nervous when they're leaving, or they're just excited to get out, or maybe they're scared. They're not sure what's happening next. It's really important to have an advocate with you, whether it's a loved one, a caregiver, a family member, a friend. And even, this may sound a little funny, bring a tape recorder or bring some notes so that you can remember that encounter for when you leave. You can say, what did the doctor say again that I was supposed to do? Have someone there that can help you with that.
I think also, too, you're responsible for your own health or your family member. So these are really good things to keep in mind. You're a doctor. You wouldn't think it was weird if somebody took notes, or
no.
I'm sure you see it.
Absolutely, and I respect that quite a bit. I mean, it used to be that patients didn't feel empowered or activated to do that, but it's really important. Patients are so complex now. They have so many conditions, so many doctors, so many appointments to keep track of. It wouldn't make sense to try to keep that all in your head.
Before we go, tell me what you have going on at Bayview.
Yeah, so there's something very exciting and revolutionary happening at Bayview called the Alicia Initiative. And basically, what it means is that we're trying to reduce some of these problems that we just talked about. So what we've done at Bayview is that one of our medical services has been reformatted to help take care of these problems. So often when you go to the hospital, you think, oh, my doctor doesn't have a lot of time for me. So what we've done is cut down the number of patients that every doctor has on this service so they can spend more time with the patient. And what they'll often do is help keep doctors talking to each other. And when the patient leaves the hospital, they'll call them, check in on them, make sure they're doing okay, and they may even visit them at home to make sure that they're doing well. So what we're doing is trying to train doctors how to take better care of patients when they leave the hospital and create a better patient experience.
Okay, give us the name of that again.
It's called the Alicia Initiative, and there's a website that we provide if people want to look at it.
Absolutely. What is
and
it?
It's very interesting. It's hopkinsmedicine.org, and they just can search under the Alicia Initiative, and then they can learn about it. And so hopefully we'll have patients experience that and tell us their opinion of what they think.
All right, Dr. Arbaje, it's always great to see you.
Thank you.
She's the best, Jamie, isn't she?
Absolutely.